Tonight, we're going to look back to a pandemic debate we haven't thought about in a while. Which was worse, COVID or COVID lockdowns? Now, the reason why we're talking about this again is because Donald Trump's pick to lead the National Institutes of Health was fine with the idea of herd immunity, which you may or may not have remembered was the idea of letting a virus run unchecked until enough people have immunity so that when someone gets infected, the virus basically has nowhere to go. Now, in our fifth seat today is Dr. Devi Nampiarampil. Thank you for joining our table. Sorry about that. I want to talk to you about Dr. Bhattacharya, who is Trump's pick to lead the NIH. What's notable about where his position was during the height of kind of COVID lockdown specifically?
Yeah, so his argument was that the lockdowns were too severe, and part of that was because he was looking at, for example, people with heart disease, people with cancer, that would they be able to get the treatment that they needed in the face of the lockdown? So it was really a question of, which is going to cause more harm in the long term, and it wasn't an all or nothing approach, like let's get rid of the lockdowns. It was more that maybe we should ease some of these restrictions for certain people. Like he even pointed out for kids, for example, that their vaccination rates were going down because they couldn't get to the pediatrician. So, balancing all these factors, he really asked some tough questions. And I think that provoked a lot of controversy at the time.
Mm-hmm. I think there are so many figures out of COVID who were, and I'm just going to use this word, radicalized, so to speak, from the experience. And just from my own reporting, like parents who came out of the lockdowns just like completely upset at their school boards or one reason or another. Tons and tons of voters who might not have been in the kind of anti-vax crowd, but had so many questions about the vaccine that they saw it as a government overreach. Can you talk to me about like how you see it having overhang in a way that I know Democrats have been suffering with?
Well, as somebody who has spent quite a bit of my career working in education policy, I think that one of the most overt ways was what we saw when it came to students returning to school. We look at the lapses in education when it came to reading, writing, and math. We look at the fact that, the socialization of those young people was extremely difficult. The higher rates of depression, anxiety, and other things from, being in isolation, essentially, for quite some time. And I think that, in retrospect, the idea is that possibly those students could have gone back to school earlier. I think that we operated under what we had at the time, which quite fortunately or unfortunately in some cases was changing rapidly. Yeah. So initially they didn't necessarily know how COVID was passed. Then we had, the social distancing. Then we had businesses that shut down, many businesses that did not recover.
I think people understand that. They just feel like maybe Democrats or progressives or the public health community hasn't acknowledged how much damage that was and in the ways that they were wrong.
Yeah, I think it's interesting. If you take a step back to 2020, one of the main reasons why Donald Trump got beat was because of his reaction to COVID, right? I mean, you think about this. He let Dr. Fauci in the Oval Office every minute of every day. Our state, Georgia, Governor Kemp and myself in the legislature opened back up much quicker and got lambasted almost every minute of every day by Donald Trump. To see the team he's building around him now is a totally different makeup. It's almost like he didn't make any of those mistakes, and that was a liability for him. So I think that was really some political coaching to build a different team around him. But look, there's no doubt about it. One of the main reasons why Donald Trump got beat in 2020 was because of his reaction to COVID. And he just never seemed to have a good plan. It left people confused. And was it lockdown one day and not lockdown the next day?
Someone else can jump in here, but in a way, I feel like one of the reasons why the Biden-Harris team suffered is because of all the things they did in response to COVID as well.
So, absolutely. So a key thing about Jay Bhattacharya to understand is obviously he supported the kind of Swedish model, the no lockdown model, which, agree with it or not, it worked out okay in Sweden, but it wasn't a disaster. It was another choice. But what happened to him? When he shared his perspective on Twitter, we know from the Twitter files it was revealed that he was put on the blacklist, right, for spreading quote-unquote misinformation when really it was just a minority viewpoint.
But Sweden is also a much healthier country. When we talk about the fact that there were so many pre-existing conditions, from diabetes, which affects a lot of youth here, when we talk about people being overweight, when we talk about blood pressure issues, autoimmune disorders, there's so much more here when we look into those factors, specifically of people who would have been at higher risk for COVID, that just do not exist in the same proximity or population in Sweden.
The more important point for Jay Bhattacharya is that he was censored from Twitter for expressing a pretty scientifically backed viewpoint that was a totally valid perspective. And people at the time were complaining about, excess censorship and regulation of Twitter, and they were completely right. And And the wisdom, what it really goes to show is when you try to suppress something, it ends up 10 times as strong. And this is the proof of that.
Totally right. That's the deep hangover that's helped propel Donald Trump back into office. I mean, I say this all the time. One of Donald Trump's, he's been talking about it for 8 or 9 years, that Washington is working against you. COVID created an even deeper distrust. We saw our health agencies fail us. We saw censorship come on. One of the things that we talk about, men who turn to Donald Trump because they're tired of being told what to do. Well, that also stems from COVID, where you were told, well, you had to get a vaccine to go into a restaurant, right? This is how you had to behave. This is how you had to act during this time. The hangover is real. The distrust in our government is real. And that's part of what has propelled him back into office.
We also saw gun-toting Americans storm state capitals because they were upset about lockdowns, which is something that is completely ridiculous.
Dr. Devi, I want to talk to you about this as well, because it feels like this is something that has rocked the public health profession in such a profound way. Like, the struggle now to rebuild trust feels like pretty profound.
Exactly. I mean, medicine and science in general is fueled by peer-reviewed research and a lot of discussion. You know, if you're trying to publish something, you take your work, you send it to your competitor so that they can tell you anonymously, but so they can tell you everything that's wrong with it, and then you try to address it. But COVID was handled a completely different way. So that's like the broad sweeping sort of view. But I think specifically in terms of medicine, we are going to see the consequences of it, and we're already seeing it, because it's not just the lockdowns were in the past. There are people who didn't get their screening and their treatment for cardiac problems. People are getting diagnosed with cancer at later stages, where something that could have been treatable is no longer treatable, perhaps, right? So the people who are at risk for COVID are generally the people who are older, who are more vulnerable, immunocompromised. But those are also the same people who are at risk from the lockdowns.
Yeah.
Because
and people have been upset about RFK Jr. having a position, obviously, in the health industry, in the cabinet. But do you think Bhattacharya, in a way, is an interesting choice? Is he corrective to some things that people now admit were a problem?
Well, I think he has the skills. You know, even before COVID, he was publishing tons of research about how to improve HIV, identification and slow the spread. He looked at low back pain. He was writing about Medicare. So he already had a lot of the skills and was accepted in the medical community. Not that that's the primary issue, but he was, And so then when he took this minority point of view, I guess it also shows, like, here's a person who's capable, who's motivated, kind of balancing these risks, but then also somewhat brave. He took on all this criticism, at a very challenging time. And so I think those are the skills you need to be able to get anything done and really investigate and be transparent about what's going on, because he wasn't afraid to be transparent before.
Yeah, Dr. Devi, thanks so much. I appreciate that.